upset you and perhaps even anger you, and it should. Anger is what sparks action, and it's time that we step up. A serial killer is on the loose, and he's killing 7 of our children each day. And it wasn't until the early 1950s that someone began to take a stand against this monster.
Entertainer Danny Thomas was born January 6, 1912. In the early 1950s, Danny Thomas started raising money for his vision. In 1960, Thomas founded the 85,000 square foot St. Jude Children's Research Hospital in Memphis, Tennessee. The research hospital first opened its doors in 1962 and still today has many patients searching for help. They received their first research grant from a study of sickle cell disease, and it carried out pioneering studies in solid tumors. After the hospital's first year of operation, they instituted over 30 research projects, as well as completed a total of 4. Although to this day, St. Jude's has partaken in research behind nearly every type of childhood cancer, it is best known for its contributions to the study behind acute lymphoblastic leukemia. Aside being known for groundbreaking findings in medical and cancer research, St. Jude Children's Research Hospital has attributed far more than scientific findings to its career cancer patients. St. Jude's is unique in that they are not only a research hospital, but also a nonprofit charity institution, and there's no other charity quite like them.
St. Jude's does its own research and also has an international outreach with 24 official partner cities in 17 different countries around the world. Connecting with others from around the world has improved the survival rate through the sharing of knowledge, technology, and organizational skills. Over the past 50 years at St. Jude's, it has helped increase the child survival rate from 20 to 80%. Having many people consulting on one case helps give each new person a fresh set of eyes for the child's care. The nurses are all trained in the best practices in clinical care and work with pathologists on techniques for accurate diagnosis, also providing children in developing countries access to modern treatments and care. According to philanthropy.com, St. Jude's Children's Research Hospital ranks as one of the top 2 most trusted nonprofit brand names in the United States. And out of every dollar donated, 83 cents has been proven to go directly to research and patient care. The families of the children receiving care from this institution never receive a medical bill. Costs of travel, housing, and even food are also often covered by the hospital, because St. Jude's believes the only thing families should be worrying about is the recovery of their child.
But all of this would be impossible without your help. St. Jude's Children's Research Hospital finances over 75% of their research and patient care through public funding. No individual signs up for medical complications, especially a child. Adults can work to bring in an income, but children cannot do so. A child should not be denied a chance at life because they lack some green sheets of paper. Through the generous donations from people like yourself, St. Jude's doors to its 2.5 million square foot hospital have remained open. There are 78,000 active patients seen at St. Jude's yearly, most treated on a continuing outpatient basis as part of ongoing research programs. There are 78 beds available for children that require hospitalization during their treatment. Children are treated from all 50 states and around the world, from St. Jude's Hospital and their 7 other affiliated clinics.
Through our findings, we have come across a lot of information, from the clinical research to the history of where it all began, and last but not least, the patients and their stories. This is the most important part of our aspects that we found, and St. Jude's website has many stories as long with the one that I'm going to read today. Not only do they have their stories, but you're able to donate to these children to help their cause. At just 1 year old, a boy named Towns, already having a flirty personality and loves his photograph being taken, and his best friend is also the family dog. When Lindsay and Todd, Towns' parents, found out their son was diagnosed with a rare brain tumor called medulloblastoma, they were devastated. After this, Towns went under surgery at a local hospital, during which the entire tumor was resected. Then his parents turned to St. Jude's Research Hospital for the rest of his care. At St. Jude's, Towns' treatment will include 6 rounds of invasive chemotherapy, followed by 6 months of oral chemotherapy. He also receives speech therapy and is working with Child Life to learn how to swallow crushed pills. But Towns' favorite person at St. Jude's is the music therapist. "She'll come in and play music, and we'll just dance," said Lindsay, Towns' mother. Towns loves to dance, and sometimes Towns will make her put her drum on her head, and he'll put a bucket on his, and they'll be the bucket-headed band. Towns' treatment hasn't slowed him down at all. He likes to play with cars and trucks just like a normal kid, and watch Lady and the Tramp and snack on popcorn. Every child's story is important, and sharing it with people makes it known that every kid deserves a chance to fight. This is why we need your help.